Good afternoon, everyone. My name is F.Cathe'y, and the purpose of this video recording is for me to complete this week's assignment on the family therapy session role play. With that being said, I would like to begin with segment 1, which is the introduction greeting with the family. Good afternoon, everyone. How are you? Please, everyone, come in and have a seat anywhere that you feel comfortable, as long as it's in such a way that we all included in the session. I would appreciate that very much. My name is F.Cathe'y, and I've been a social worker for the past 31 years. And the reason I say that is not to brag or boast, but to let you know that I am truly dedicated to helping others such as yourself. And also in helping others, I always find something or some way to help myself as well. Okay, now, before we continue, I feel quite sure that you came into this office, and the first question I have is, has any of you ever been involved in any type of therapy before? No? Well, let me briefly explain the purpose for this type of counseling session. It is the aim of myself to serve as a mediator or a collaborative partner in helping you guys to reach some type of positive resolution to your problems and or concerns. And I'd also like to say that it's been my life experience that I'm going to be only as good as helping you as you are at disclosing to me your ideas, thoughts, and feelings as they may relate to the issues and concerns that you bring in, to therapy with you. By way of a better explanation, let me just simply say that if you go into a doctor's office, and despite all the degrees he may have on the wall and the personality he presents, that doctor himself may write a prescription out for you. You may go home, and after a week or so, you may say, wow, he's a great doctor. But then upon reflection, you'll have to say and admit to yourself, well, the thing that makes him a great doctor was his ability to listen to the concerns and problems that I presented to him. If I went in there and just sat back and didn't open my mouth, he would have no idea as to how to treat me, to help me, or what to prescribe for me as a means of helping me to get better. And that's primarily how this family therapy works. You come in, and hopefully you'll be able to feel comfortable and relaxed and trust me enough, with your information and my abilities as a worker to help you. Because I can't do anything without your input. So in essence, this is a collaborative, team-working effort to resolve your problems. Okay? All right. So, with that being said, who would like to begin by telling me what's going on? And hopefully and blessedly, I'll be able to be of a great source of help to you, as I'm sure I'm going to learn something as well. Segment 2, couple bickering, my intervention. Pardon me, with all due respect, would you allow me to intervene? Okay? I understand that tempers may be high, and as things are being expressed that you probably never heard of or thought was going on with your partner, or your husband or your wife. However, I would like to suggest to you that as opposed to allowing yourselves to become angry and to react to the emotions that are brought up as a result of what's being said or what you're hearing, there's a technique I would like you to try with me. The first is very simple, and all you have to do is this. When someone says something that you don't agree with or something that you find yourself physically or mentally reacting to in a negative manner, the first thing we do is stop. Take a deep breath. Come on, I'll do it with you. Count to 3. And then blow it out slowly. And that is an intervention that's called a cool down period. And what that does is to allow you to regain your composure so that you will be able to respond with thought to what's being said and what's being heard, as opposed to just emotionally or angrily reacting without thought. It seems to work, and I like to suggest that, especially in lieu of the fact that you guys have these two beautiful children, and they learn from you, from watching your behaviors and the way you interact with and speak to one another. Okay, you think that's a good idea? Okay, you can keep that. It's a gift from me to you. End segment 2. Beginning of segment 3, ending the session. Well, I'd like to thank all of you for coming in and for granting me the opportunity to get to know you, and I hope that you guys are beginning to know me. Because as I expressed in the beginning, for us to be successful in helping you to reach problem resolutions or to find ways to find an end to your concerns and your fears or worries or anxieties is through the working collaborative, working as one unit relationship built on trust. I appreciate, your being forthcoming and disclosing as much about yourselves in this initial session as you have, and I hope to learn more as we go forward. Also, I would like to suggest that you utilize as a homework assignment the newer technique that I suggested to you in regards to the ways you communicate with one another. Please remember to just stop. Do not react. Just stop. Pause. Take that deep breath. Hold it for the count of 3. And release and respond. I'm sure you'll find that it's going to be quite beneficial in terms of your learning how to better and more effectively communicate your ideas, thoughts, feelings, and concerns to one another, because I'm pretty sure you love one another, otherwise you wouldn't be here. And also keep in mind that you're modeling for your children the behaviors you would like them to have as they continue to grow and develop into their young adulthood and adulthood. So, once again, I appreciate you coming in, and I've enjoyed getting to know you. Also, I will leave it up to you, because I understand that you both work full-time jobs. So when do you think it would be most convenient for you two to come back in for your next session? Oh, next Thursday at 2? Let me check my book. Well, wouldn't you know that? It's a perfect timing for me as well. So I'll schedule you in for next Thursday at 2. And I look forward to meeting and speaking with you and working with you and prayerfully helping you again in resolving your issues next Thursday. In the meantime, continue to love one another, be kind to one another, and most importantly, learn to better communicate with one another by way of responding and not reacting from the place of emotion that leads us to anger and irrational thoughts and things like that. So just try to remember the love and respect you have for one another. Take that deep breath when needed, and I'm pretty sure as you do it, you'll get better at it, and your communication skills will grow, and your relationship will progress and prosper. So until next week, be blessed, be happy, and I look forward to seeing you then. Bye-bye. End segment 3.